again, ladies and gentlemen, as I was mentioning earlier, I'm going to mute everyone except for the presenter. And if you have any questions or anything that you need to raise a doubt or get more clarification from Dr. Alwin, you can wait towards the end of the session to ask questions about it, or you can always type your question out in the chat room. All right, and we'll ensure that we answer your questions towards the end of the session. All right, so if I'm not mistaken, we have about 10 seconds left. So, Dr. Alvin, I presume that you have something to share.
I'm ready whenever you are.
Hi, Dr. Alwin.
Hi, Jordan. Okay.
You can share your screen.
Okay. You want me to start?
Yes, you can.
Okay.
Before that, once again, welcome everyone to very interesting presentation today, brought to you by Vexi Plus and powered by Magnitude Healthcare. Now, most of you here do not know what is Vexi Plus. Now, Vexi Plus is a community educators program first introduced by Magnitude Healthcare Consultancy. More and more people to become advocate towards preventive health care. Now, you see, there are two types of branches in medicine. Okay, one is curative healthcare and the other one is preventive healthcare. Now, curative healthcare is something that you have something wrong with you and you go for medication or surgery or something like that once it has happened to you. Now we are talking about preventive healthcare. Now this is a branch of medicine that what to do to take steps so that it doesn't went to healthcare. Now we are not going to talk to you about a miracle medicine. We are not going to talk to you about something different, even though the title of today's presentation is Forces of the Medical World. Please keep an open mind and get entertained today, or at the very least, get a lot of knowledge from Dr. Alba. We'll be talking to you about gene testing, right? All about for CSI, for crime scene investigators, forget National Geographic, all these things. We are here to talk facts, scientific facts, the advancement that scientific technology has attained in in preventive healthcare. So without much further ado, Dr. Alvin, it's all yours. Thank you.
Thank you, Mr. Jeevan, for the kind introduction. And thank you very much, everybody, for being here. Now, let me first introduce my topic and then I shall introduce myself. Can you all see my slides?
Yes.
Can everybody see my slides?
Yeah, yes.
Okay. My topic today will be about the medical fortune tellers, and I shall be attempting to demystify gene testing. Now, for those who don't know me, my name is Alwin Ram, and I am actually the group CEO of Magnitude Healthcare. We're a whole group of companies, and I'm also the medical director, and I'm also the medical advisor and the chair of the medical advisory panel for the Vexi Plus program. Now, I do not claim myself to be a geneticist. Neither do I claim to be an expert in it. My background is, in fact, in surgery. I spent 10 years of my life in the surgical department before I left government service. So what will I be talking about? I will not be going into details regarding how genes work and how genetic, more of this but how it affects you and how it's important and how things have changed in terms of genetic testing. I will talk a little bit about contemporary things. We'll talk about predicting the future. No, I'm not trying to be a fortune teller, but I will be trying to predict your future. We will talk about evidence-based medicine. We will talk a little bit about the sciences involved. Yeah, the science involved. We also talk about how gene testing is done and how you interpret it. And most importantly, the last one is how genetics affect you and how we can use that to predict the future. All right, so let's get on with the presentation. I won't bore you with my face any longer. So, ladies and gentlemen, since time immemorial, since the dawn of civilization, everybody has been trying to predict futures, has been trying to tell things about themselves. We try to look at palms to tell whether there are certain aspects about our bodies, about our health, about our future, which we can detect from the palm, from lines of the palm. We try to look at people's face to tell whether or not they may be having certain other types of diseases or conditions just by looking at their face. Now, this has been going on for years and has been used by different civilizations, the Indians, the Chinese, and recently we have there has been some evidence to say that people who have got sallow complexion, yellowish sclera. So recent, when I mean recent, I mean about 100 years. Yeah. Yellowish sclera could mean that they have got biliary problems. But for more than thousands of years, people from different civilizations have been using these techniques to identify problems occurring with a certain individual, and even trying their level best to even predict a person's future and lifespan, etc. Then we have astrology, where people try to predict your future, your career, your wealth by looking at the stars. And the Chinese have been using Baji to look at the different seasons and compare it to how you will turn out to be. So the big question here is, are these people practicing ancient science, or are we just looking at a whole bunch of bollocks, so to speak? Now, what differentiates a medical man and a medicine man? For those of you who are not familiar with the term medicine man is what the Malays call the bomo, the person that you go to when you think that you may have an evil spirit with you. What difference does the two of them have? Now, if you look at this lady and you look at this lady, they are both pretty much doing almost the same thing. But one person is doing it in an aircon room wearing a white robe and you call them a doctor and you pay them thousands of dollars. The other person, you probably give her a cow, maybe not even a cow, maybe a kale of vegetables, and you go back feeling better. What differentiates these two is basically the practice of evidence. In today's talk, we'll talk a lot about evidence. So what is evidence? Medical evidence. We are able to come up with evidence which we use to treat diseases and to prevent diseases from the results of independent scientific studies, which are performed systematically. That means there's a system of which we do it. And most importantly, it is reproducible. What we mean reproducible means that if I do a study and somebody else in India, somebody else in US and UK do the same study, we must be able to produce the same results. Failure of which we must be able to find a reason why the results differ. And there are many ways that a study can be conducted and becomes evidence. Of course, if you see expert opinion is very, very different from your auntie's opinion or your grandmother's opinion. Well, they can be experts. They can definitely be experts as well. But it basically means that these people are qualified and have certain qualifications and experience that they can make a certain point and prove that point. So, but even so, it is the weakest form of evidence that we can use and rely on. So basically, the strongest is meta-analysis. What is meta-analysis? It is basically, I won't go into details of it, but basically it is just a study of studies. You review all the studies which are being conducted, and you group it all together, and you come up with a study. So that is the strongest. The reason it's the strongest is because we look at how these results can be reproduced in different communities. So why do we practice evidence-based medicine, and why is it so important in today's talk? Because evidence-based medicine answers the question, what are we dealing with and how is it coming about? And it ensures that you get the best treatment and best diagnostic modalities, because science and medicine is so fluid that it changes from day to day. And to ensure that your treatment is not by trial and error, but it has been proven before it is being administered to you. So that is the biggest difference between the medical man, the lady on the right, more of the medical lady, not to be gender biased, or the medicine lady on the left. So now let's go into the science behind gene testing. Now, we all know that these two gentlemen, which are Watson on the left and Mr. Crick on the right, won themselves a Nobel Peace Prize in the 1960s in the identification of the double helix model of the DNA. But even before that, long before that, in 1869, Frederick Meissner, who is a Swedish chemist, have actually been able to identify the presence of DNA within certain bacteria and viruses. And that's how long ago, and even before, and from him until Watson and Crick, we have so many people who have worked to identify the DNA and to describe the DNA. And why is it so important? Is because everybody is trying to find the answer to what life is. So what is the DNA? We are very familiar with this structure. This structure is what we call as a double helix. Why is it called a double helix? Because it has two curves. It curves in 3 dimensions. It makes 2 swirls. And if you see the CGTA in between, those are actually nucleotide bases. Those are the foundations of DNA. So what is DNA? DNA stands for deoxyribonucleic acid. DNA is made up of different types of sugars. If you the term we use is sugars, which is the 5 carbon, and they are actually double-stranded. There are 2 strands of it who join, and they join in the middle. So these 2 strands, as they join in the middle, they actually become the basis of coding. So what depends on that, if you see here, there are different types of nucleotides as adenine, guanine, thymine, and cytosine. There are 4 different types, and they bind complementary. What it means by binding complementary is there's a certain way by which strand A and strand B are joined at those bases, and the sequence of which these bases are joined forms a code, and this is the code that codes for every single thing in life. Because of COVID-19, we have now always heard the term DNA and RNA when we do these PCR tests. We are told that that COVID-19, the coronavirus, is an RNA virus and not a DNA virus. But we must also understand that humans have both DNA and RNA. So what's the difference? And you will find that it is quite important to understand them. DNA has got 2 sugars. Forget about the terms itself. But DNA consists of 2 strands. RNA only consists of 1 strand. That means the bases, which you see the purple color, orange color, is open. It is open-ended. It is available for it to bind and to get stuck with another nucleotide base. So what is it used for? DNA is basically the storage mechanism for the data, and RNA is the transfer mechanism. What happens is when a code needs to be decoded, the DNA is being opened up into individual strands, and the RNA will transfer this information in a process that we call transcription. And from this transcription, from what we call the messenger RNA, If you hear the vaccine using messenger RNA, yes, that is the component that is being used, the messenger RNA, mRNA, then translates, you see the term translation, translates that into the formation of amino acids. And amino acids are actually the compounds that make proteins. So everything which is being expressed, what is a virus, what is a bacteria, what needs to be destroyed and what needs to be kept in the human body are actually proteins. Everything is proteins. The term antigen that you hear so often in our COVID-19 nowadays, the term antibody, all of these are nothing but proteins. And the expression of these proteins are determined by the DNA, and they are being transcripted and translated by the RNA and its relevant enzymes into producing the proteins that form the basis of life. So basically, the difference between DNA and RNA, the DNA stores the information, and RNA is the carrier of such data for it to be produced as proteins. So how are the codes being identified? Now let us take an example. For the purpose of confidentiality, I had to blur this image, but this is a web page. The green color is a web page, and the right is are the codes. Now, if you see, the codes look nothing like the web page, but we know that every alphabet, every picture there codes for something: the background, the color, the images, etc., etc., etc. The same thing happens in the DNA. Every segment of DNA codes for something, but we have realized that only 3 to 7% of the human DNA actually codes for something. An extra 90% actually are non-coding. That means it doesn't code for anything, or we do not know what it codes for. And the sequence actually tells us where to start and when to end. And a series of codes will code for different types of proteins. So what we are looking at here is we are looking at a sequence of alphabets, the TCT, GGT, and so on, which will code for a specific protein, serine, glycine. And the sequence of the serine and glycine and the different types of amino acids will again then determine the type of protein that's being produced. And hence, just a handful of different types of genes will give us a whole set of information. So this is a schematics of how the DNA is being stored in the chromosomes, and they are being opened up and transcribed and translated and produced. These are just representations for you to have. All right, so that is the boring part about the science behind it for some people who may remember from your Form 5 or A-levels science. Now, if you have studied this in school, trust me, you are considered young. You're about my age. If you have not studied this in school, then you are part of the more experienced crowd. So what is gene testing? What do we test? And how is it being done? Gene testing, first we must understand that there are over 3 billion base pairs in the human. And about 30,000 base pairs are code. About 30,000 base pairs forms codes, which codes for something. And all of these codes basically forms the proteins that form what we are. So where do we find DNA? DNA is available in every single cell in our body. They are located in the nucleus. You can find the RNA inside in the mRNA. They're located in different parts of it. Or you can even do what we call as a reverse transcriptase in PCR, which is you find the protein and you go backwards to get the RNA and then the DNA. So you get it in hair, you get it from the cheekbone and every single cell. So when we talk about DNA testing, we can take it from a cheek swab. We can take a swab of the cheek, because even small amounts of cells that get stuck will be able to produce DNA. But you can even get it from spit of saliva, because your saliva contains some cells which are being shed. We can take it from blood. But when we take blood for DNA tests, what we are getting is not actually blood itself, the red blood cell. We are looking for the Buffy code. The Buffy code is the code in between the red and white blood cells when they're being separated, and that contains the white blood cells, which actually contains the nucleus for DNA. We can get it, of course, from any other forms of body fluid. We can get it from amniocentesis, from the amnion, the fluid around the sac of a baby. We can get it from the umbilicus cord of the baby. We can get it from needle aspirations, from bone marrow, even from different all types of body fluids, even from urine, from seminal fluids, vaginal fluids, etc., even in tears. What happens is, using blood as an example, DNA is being extracted. It is being sequenced. The whole sequence of DNA will be procured, will be extracted, and it will be interpreted in the form of data. So this raw data tells us what gene is being expressed or not expressed. But what is important from there are the last two components, which are the interpretation and reports. How do we interpret genes? We interpret genes based on evidence that has been gathered over the years and identified to link certain genes to certain conditions. And from there, we generate a report. Now, it is important to note that with so many different types of genetic codes and genes, it is important that we identify what are we looking for. And it is not possible to actually sequence the whole thing. And it is still an ongoing process where we are trying to decode the whole genetic code that makes up a human. So what do we do? What do we use gene testing for? It can be used for predictive, diagnostic, and profiling purposes. Now, there are many ways that people have classified gene testing, but I like to use these three profiles because it kinds of makes it relevant to the layperson. But of course, scientifically, we've got different ways, different characteristics, and of which that we define gene testing. So we use gene testing to predict diseases. Predictive gene testing is testing people who are asymptomatic, who do not have any other problems, and we look for risk of these people developing certain diseases. So when do we do it? Premarital, preconception. I think these are the main, this is the main times that people ever consider genetic testing before you make another human being. This can be done either before someone gets married, or nowadays some very career-oriented women are trying to get children without a husband. So before any form of artificial insemination or even IVF, very often people actually undergo gene testing. What are we looking for? We're looking for specific genes or mutations which may pose a risk, such as this, to the child. So you may not be a sufferer of a certain condition because you only carry half the gene. But if your husband or your wife also carries the other half of the gene, there is a possibility that the child may either be a carrier or may have the full-blown diseases. This is particularly important for conditions such as thalassemia, hemophilia, and sickle cell. All of these are blood diseases. What happens after you have done it? Now, it's very important to understand that it's not just about doing the test, but what happens after the test is being done. You must understand the percentage of risk of all of these diseases and must be then counseled on what the next step will be. So this is one of the testings that we see very often, which is premarital and preconception gene testing. Another one is for antenatal, for children. How do we do it? It can be done between 15 to 20 weeks of gestation. That means when we're in the mother's womb, under ultrasound guidance, we put the needle into the skin, into the womb, into the amniotic sac. We take a bit of fluids and we send it to the lab, and we try to check for any genetic disorders. Or when the baby is born, immediately as the baby is born, a heel prick is being done and a bit of blood is being taken. Most of the time, we are looking for any form of genetic mutations which can be seen in the chromosomes, which may cause syndromes like Down syndromes or any other diseases which may cause inborn errors of metabolism. More often than not, the reason why we do amniocentesis is to make a decision on whether the pregnancy should continue or not. In my own career, when I was a very junior doctor in the obstetrics department, we had aborted 3. We had terminated 3 pregnancies that I've personally been involved in, because 2 of which the baby was detected first by ultrasound and confirmed by genetic testing that the baby had no brain. Not to be confused with the brainless people that we see on the roads every day, but baby had was to be born without the brain. So we terminated the pregnancy at about 20 weeks. We have also one more child that was Down syndrome that the mother wanted to terminate at about 20 weeks before that. So one of the interventions that we do, termination of pregnancy in conditions where the child is not compatible with life. And in newborn babies is to be able to deal with expectations and for early management of any conditions which may come about. In adults, we do gene testing for risk stratification to identify specific risks, such as the presence of BRCA1 and 2 genes, which may put you at risk of breast cancer, or the KRAS gene, which may put somebody at risk of colorectal cancers. So you're looking for specific codes in screening of adults, so that we can treat and manage them by increasing the frequency of screening, or in some conditions to even do preventive intervention, such as in familial adenopolyposis coli, which is a condition where there's a lot of polyps which appear inside the gut. That because 100% of them actually become cancerous, we remove the whole large intestines in this group of people once it's being detected. We don't wait until cancer happens. We also use, so in predictive gene testing, we do the test in people who are asymptomatic, who do not show any form of symptoms. In diagnostic testings, we perform genetic testings for the purpose of differentiating different types of diseases. Now, if you see on the left, these are FAP, familial adenopolyposis, and on the right is hereditary non-polyposis coli. So if you look at it, they both look the same under a scope, but when you take the genes, they are actually very different genetically. Well, morphologically, even in the way it looks, the HNPCC are slightly different compared to FAP. But what's more important than that, the identification of it, is because in FAP, 100% of patients develop colon cancer, whereas in HNPCC, only 50 to 70%. What does this mean? It means that if a patient comes back with a FAP gene, the whole large intestine will be removed, whereas in patients who have HNPCC, regular screening would suffice, because there's still a chance that 30 to 50% of them do not become cancerous. So understanding, using this as an example, we know that genetic testing can be used to differentiate diseases. Some diseases may mimic something else. For example, these are kidneys. This condition is what we call as an autosomal dominant polycystic kidney disease. It may be polycystic disease, but it may also be random disease. It may be also random kidney polyps. So what happens is, if we come across patients who have this condition, we look for the genes which code for ADPKD for 2 reasons. Number 1, we may need to test their descendants. And number 2, patients who have this condition also will have polyps in other parts of the body, such as the gallbladder, the liver, and the lungs. Gallstones. Gallstones may seem quite common in patients. We go through about 10 gallstone surgeries a week in some hospitals, but in younger patients who have gallstones, you want to look for, among other things, cystic fibrosis. Cystic fibrosis is known to be a disease of the lungs, where the mucus becomes very thick and block up the lungs. But more often than not, in very young children, the detection of cystic fibrosis actually comes from the presence of gallstones as when they're young. We have hemocysteinuria, which actually manifests as gallstones. All of this, and that's why young patients who have gallstones almost always require a genetic test. If you see this is a picture of a vagina and a penis. This is what we call as hermaphroditism. Hermaphroditism, people who express both the male and female genes and male and female characteristics. And one of the only ways that we can differentiate between male and female are by genetic testing, and we can differentiate whether they are XX or XY. But the laws in Malaysia at this moment in time do not require genetic testing to differentiate between male and female, but by a person's affinity. So if a person who is hermaphrodite can then choose to be male or female. But in many countries in the world, gender of hermaphrodites are decided by the presence of the Y chromosome. And this is just a few of the other types of genetic disorders which can be detected in children through genetic testing. Now, in more modern times, we are looking at targeted therapy. Mainly seen in cancers, what we're trying to do is you're trying to identify the different types of gene which cause cancer and attack them specifically. You're looking at receptor-specific genes such as the proteins that are expressed a certain genetic sequence. You are targeting cells that express a genetic sequence, or you're targeting a certain code that can influence replication, such as codes that code for growth factors. What we are trying to do in more layman terms is to prevent a napalm strike. If you remember Hiroshima and Nagasaki, the atom bomb that was being dropped, it did not differentiate between the soldiers and the civilians, and you destroy everything under the sun. Whereas the picture on the left, the grayscale picture, is a more specific strike. You only target certain military establishments, which is what we are trying to do in gene-targeted therapy. Some examples are seen in HER2 receptors in breast cancer, in leukemia, growth factors. So when we give chemotherapy or any other therapies, including for some immune conditions and diseases, you only want to target and modulate or change certain cells or certain genetic sequence so as not to cause very widespread injuries to all other surrounding tissues. So yeah, that makes this form of therapy definitely better tolerated and have better impact and outcomes as well. We also want to look at the ability of we want to look at the progression and prognosis of a disease. Certain genes, when present, tells you that the outcome may be good because you can do something about it. You can target it and destroy it. But certain genes, when they are present, tells you that the outcome may not be good. So based on these genes and based on evidence that we have seen from the association of these genes and the outcomes, we can potentially predict the lifespan of certain people who have got certain diseases. It is also beneficial to note that, particularly in breast cancer, where a lot of work has been done, the presence of the estrogen, the progesterone, and the HER2 receptors are known to be good outcomes because you can target these receptors by using certain drugs, hormonal drugs. And the absence of it signifies very bad outcome because you cannot stop the cancer growth by using drugs. It can also tell us the absence or presence of genes or whether certain cancer will be susceptible to radiotherapy and so on and so forth. All right, so that is using gene testing for diagnostic purposes. But here's the interesting part now. Genetic testing in today's world is not just meant for prediction or diagnosis. We are more and more using it into defining who you are. Because at the end of the day, we as humans are all just a lump of protein and chemical reactions. And how we act and feel and even carry ourselves are more or less determined by the DNA that codes for us. Now, this is a chemical pathway. I will not bore you with this, but I just want you to know that this is what happens when you feel sad. A certain amount of chemicals are being released, and the type of chemical that's being released and the type of enzymes which are being released and how long it stays in there are all being coded by your genes. So in other words, it is safe to say that how you feel, how you express yourself are already being coded by your DNA. And this image is actually represents a depressed person. So you can know that all our thought processes and our emotions, because anger or happiness, is nothing but a chemical reaction. DNA also codes for the creases on your palm. Now, if you see the single palmar crease, or what we call medically as the simian crease, that is quite often seen in Down syndrome, children, but we also have seen them in regular people. But seeing this crease actually points us to a certain direction that these people may have other conditions, particularly kidney conditions, if they only have a single palmar crease. Your facial features are also being coded. Every single face on how you look, from the way you look to the way you talk and smile, are being coded by different types of genes. Now, if you see here, this is the influenza virus. There are different types of influenza virus. Just citing this as an example, we can know that forget about the numbers and the alphabets there. That why do we get different types of the same virus? Because the viruses actually change their DNA based on the season, based on the different types of year. So different types of year that you come across, you get different variations of the DNA in the virus. So now, using that as an example, we know that our DNA makes us what we are. So we can profile a person by doing genetic testing. We are able to generate a profile of that person. We can even tell how the person's physical characteristics will be. Now, there are two things that we need to bear in mind. There is the genotype and the phenotype. The genotype is what your genes code for. The phenotype is what we see, or what we call as the traits, characteristics or traits. Traits or characteristics of a person, physical characteristics, are influenced by two things. One, your genes, which you get from your parents, and external factors, which are influenced by the environment. So you will be able to tell a person's and predict a person's eye color based by just looking at their parents' eye color. But at the same time, there can be genetic changes due to external stimulation, such as this. Now, Barrett's esophagus happens because of acid reflux in the stomach, and the different cell types, if you see the red color cell type, they're stomach-like cell type, and the white color are esophagus. So the different cell types tend to change. The DNA which codes for it changes, and then and therefore they respond to external stimulation and they change. Now, this is pathological, of course, but even in natural circumstances, we do know that conditions such as chest hair are being affected by temperature. Some people, you can see people who have been in different countries, even twins who may be in different parts of the world, develop certain characteristics because external factors can actually suppress or stimulate certain parts of our genes to show its characteristics. So those are the traits, the things that we see, the physical characteristics of a person are what we call as the traits of a person, and they are influenced by our genes and our environment. So not only can we know a person's physical characteristics by genetic profiling, we also can know how you react to certain things. This is a skin. If you look carefully, you will see there are different pigmentations, there are different colors from dark brown to light brown, and different, because this is what we call as uneven pigmentation. And this comes from the different response of people to sunlight. Some people do not respond to sunlight, some people respond unevenly, and even different cells in a person can actually respond very differently to sunlight. So people like this will require personalized treatment or therapy, certain personalized ointments or serums or creams to specially protect them. Otherwise, they get worsening discoloration of the face. All this can be detected by genetic codes. Sorry, Emma Watson, but different people again age differently. And the way a person ages, whether you age gracefully, the way a person develop freckles and aging spots, all of it are also coded in your genes. So if a certain person actually age faster than somebody else, more likely than not, it is also coded in the genes. Our response to medications, and that is why we have seen certain people before the 1980s, people just claim that they do not respond to certain medications or they're allergic to certain medications. But now we know that the ability for us to respond to certain medications or not to respond to those medications are also coded in our genes. And from there, we can use targeted treatments in order to target people who do not respond to certain medications. And our genes also tell us how we will respond to certain emotional stimuli, the way we smile, the way we talk, the way we laugh, the way we frown, or even how we react to sadness, to anger. Even if when a person is being said to be short-tempered, short-fused, or always depressed and always down, introverted, extroverted, all of this are coded in your genes. Because these genes actually decide on your physical, metabolical, and emotional reactions to any form of stimuli from the environment, any form of things that come in and irritate you. Our genes can tell us about metabolism as well. So many people ask, is there such thing as a fat gene? The answer is yes and no. Basically, your gene describes your ability to lose weight. Why and how? It basically means your metabolism rate, your ability to store fat, your metabolism of fat, and your response to exercise. There's something that's called the ALCAN1 gene, which actually determines your ability to build muscle and your muscle mass and the metabolism of proteins. Your genes also tell you whether you are able to metabolize certain drugs or you are unable to metabolize certain drugs, and therefore makes these drugs more likely to be toxic or less potent depending on your ability to metabolize and excrete these drugs. It also, some people ask, do all Asians have Asian flush? Actually, it's the other way around. The picture on the left is supposed to be before. This is actually because of the expression of a gene that codes for an enzyme called alcohol dehydrogenase. So some people actually do develop redness or flushing because alcohol actually causes dilatation of the blood vessels. The absence of alcohol dehydrogenase, the byproducts of the alcohol, can actually cause flushing, not only of the face, but also of the chest and other parts of the body. And epidemiology and evidence study shows that it is more pronounced in Asian populations. Genes also can tell you how you metabolize your food, your ability to absorb different types of nutrients, vitamins, and minerals, and therefore the need for you to supplement yourself with different types of supplements, or to increase or decrease certain intake of food. So basically, your genes also are able to tell your ability to flush out, your ability to keep and to absorb different types of nutrients and supplements, as well as to lose weight. We also use genetics for forensic profiling. We use it for rape kits to identify the perpetrators. In mass casualty conditions, we are able to identify a victim just from a single tissue. We're able to identify a suspect sometimes just by skin or hair underneath the fingernails, and most importantly, for paternity tests to identify whether the child is actually yours. Now, because DNA is found in every single cell in a person's body, And because DNA, you only require a little bit of these cells to find a DNA. And because DNA is so hardy and so difficult to be destroyed, we now realize that the genetics have changed the way we solve crime and to solve civil cases involving inheritance and paternity tests. I won't go into detail of it. All right, so that's about gene testing. Now we have done the test, we've gotten the results. But very importantly, after we have done the test, we must interpret these test results. Does anybody remember who said this? With great power comes great responsibility. Yes, your friendly neighborhood Spider-Man. Okay, let's take a short break. Are there any questions from the floor at this moment before we proceed? We are more than halfway through. Any questions that I can answer? I'll just probably take one or two questions. You can just unmute yourself and ask the question.
Hi, Dr. Alwin. This is Purna. I have a question.
Hi, Purna.
Hi. Are there any risks in genetic testings, especially in amniocentesis?
Okay. Risk comes in two forms. First, you have your procedural risk. Amniocentesis, of course, there's always a risk, the procedural risk itself to the mother and child. Because you're introducing a needle, I would just, no, I'm not as handsome as this guy, but just show myself. You're introducing a needle into the abdomen. So what happens is your risk is, number one, bleeding, definitely. Number two, injury to the child. There's always a risk of injury to a child, but those risks are very, very minimal. You're looking at 0.1% because it's all ultrasound guided. So I have never been involved in amniocentesis, but literature shows that the risk is roughly about 0.1, less than 0.1%. Now, the other risk that we talk about in genetic testing is medical legal risk. Why medical legal risk is this? Genetic testing has never been mandatory in Malaysia, but in US, there are certain tests which are being done automatically. And even in Malaysia, actually, we do test for thalassemia at birth. All babies are being tested for thalassemia. But what happens if you do a gene testing? And I guess these questions should best be answered by anybody from the insurance field. What happens if you have done a gene test and your results do show that you are at a certain risk, and or evidence based on literature shows that your risk of contracting a heart condition is 20-30% higher than the average population? Is that going to increase your insurance premium? So those are the risks that we see in genetic testing. Now, the insurance people has not made it mandatory for doctors to reveal genetic testings. However, there is a segment in the form now which do ask you to declare if gene testing has been done before in some of the insurance policies. So I'm not able to answer that, but those are some of the risks in genetic testing. Otherwise, spitting into a test tube or taking a bit of blood, practically no risk in there.
Of course. Can I ask you one more question if you don't mind?
Sure.
Are genetic test results definitive?
Okay. That's a very vague question, actually. Now, what happens in what I've shown you just now, what happens is we identify a segment of your gene based on whatever that we are testing for. You can be looking for wellness tests, you can be looking for certain codes for cancers, etc. Based on this test, we are able to know the percentage risk that you have into developing something. So in that sense, you can say that it is definitive because it identifies that you have the gene. But it is not definitive because we cannot say 100% that you will develop that, because every gene may or may not translate into the disease. But we can only rely back on evidence and literature to tell us what percentage of risk you will have into developing it. This is very different compared to diagnostic testing. Diagnostic gene testing, for example, for certain cancers, if you have it, you will respond or you will not respond. Or if you have it, we diagnose you with a certain condition. Like a trisomy 21, if you have it, it is Down syndrome. So that's very different. When we talk about predictive or for gene screening, then it is definitive because yes, you have the gene, but it's not definitive because no, we do not tell you 100% you will express that gene. Hope that answers your question.
Thank you, Dr. Alwin.
No problem. Any other questions? I'll take one more before we continue. Any other questions? All right. No, I'm halfway through. We hope to end this session before midnight. I'm just joking. I have just another few more slides to go. Okay, so now moving away from Spider-Man for a bit. With great power comes great responsibility. That means basically what we're trying to say is, if you know something, you have to act and you have to do something about it. In the market today, there are many different types of genetic testing kits. What these kits are basically are just the container of which you put your saliva or your throat swab or whatever swab into it, and you put it in, and it's very stable, so you can then mail it back to whoever they're doing out. Do not get me wrong, none of these brands are being endorsed by anybody here, and as a medical professional, I'm not supposed to endorse any brand. But these are just an example, and these are at least about 7-8 different types of brands which are shown here, which are commercially available, and you see all of these advertisements. Now, you have done the test, you have split into a container, you have sent it to the lab. Now the lab comes back to you with a certain report. And you look at the report and it tells you a lot of things. And because of that, you form all forms of delusions, all forms, and you start overthinking about it just because you have this gene and that gene. Because of that, we tell you that the most important thing about gene testing is its interpretation. Just like Puna's question earlier, which was very, very pertinent, is it definitive? If I have a certain gene, what does it mean? What is the evidence that we see here? I go back again to evidence-based medicine. Evidence-based medicine is the results of clinical trials, clinical expertise, and the patient. And only with all three components of this are we able to give the best counseling and interpretation for the gene testing. How do we know that a certain gene will actually express a certain, or what percentage of risk a person will have developing a certain condition if they have the gene? This is through multiple reproducible studies that have shown associations between the presence or absence of a gene and a specific condition. Because of that, the ability to tell you whether you will develop is always expressed in numbers, a certain percentage. And this takes into account many other factors: your environment, your family background, your job, the environment you're in, the country you're in, your ethnicity, your race, even the stress caused by your wife or husband sometimes. All of these are important factors into determining the percentage risk of getting a condition from a gene testing. So yes, you have that gene, but we do not tell you for sure that you will be expressed, that you will develop. So what's important is the context of which we do the gene testing. It is so important to be able to engage with a medical professional for them to understand your background, the person that you are, because the person that you are differentiates you from your gene. We must always remember that you are more than your gene. And from that, we know that you must have a pre-test counseling in order for you to bear your expectations, to know the purpose of why you are doing your test. And after the test is being done, the test must be reviewed by a medical professional. We have to match that results to you. We must understand what that result means to you. And we need to know which area we want to focus. There are some areas of a genetic test that will say, okay, fine, it's there, fine, but just leave it. And most importantly, it is for us to plan and manage based on the information that we know. So with great information that we have gathered from genetic testing comes a very great responsibility to be able to plan and manage the results and the person of which the results have been given to. So now, what's the relationship with genetic testing and you? Now, genetic testing are able to reveal parts of yourself that you never knew you had. It's able to tell you and predict to a certain extent what your future holds. It is not to create different versions of yourself, but technically, if we are able to identify the whole gene that makes up a person, we are able to replicate it and to a certain degree of accuracy into behaviors, into emotions, into moods, physical traits and characteristics. And it's not too far away. Some of you may remember this bunch of guys. This is Doris, the sheeps. They are all identical. They're all identical temperaments because they were all created out from the same gene. So we are not too far away from that. And of course, the religious authorities are preventing this from happening. But that's besides the point. And we're able to adjust these genes before they are being reproduced. But in clinical medicine, that's not, but these are all laboratory. In clinical medicine, this is not what we're trying to do. We're trying to look at what we call as the 4 Ps: personalize, precision, to plan, and to prevent disease. So what is personalized medicine? With the results of your genetic testing, we're able to personalize everything to you. It is what makes you stand out from the rest of the world. It is what makes you different. The slight mutation or the slight variations, I like to use the word variations more than mutations. The slight variations differentiates you. The slant of your eye. If you just talk about the slant of your eye, we can talk about 10 different slants of your eyes. But what makes you you is because it's not just the slant of your eye, it's the color of your eye, it's the color of your sclera, it's the shape of your eye, the shape of your nose. That makes you you. That's how we differentiate a person. So it is not just about facial features. We also talk about the ability to treat. Traditionally, when we give medicine, one medicine fits all. You give a certain type of antibiotic and you expect it to treat everybody. But now we know that because of your genes and because of your environment, because of your race, your gender, etc., some people may respond, some people may not respond, some people may need the dose to be adjusted to them. So with that, we are able to personalize each and every medication. Of course, it is still not so widely accepted yet, but we are working towards it. The healthcare, medicine, the medical field, medical community is working towards being able to personalize your medication for you by knowing from your genes how you absorb this medication, how you react to this medication, will you be allergic to it. And it's not just medication, we're talking about supplements. We are talking about the ability to change a medication so that it best fits you. We are also talking about the ability for us to customize exercises, to customize sports, to tell you that you should or should not play certain sports because you may be at risk of having bone injury, of fractures, of risk of having muscular tears. We're able to tell you that because of your high risk of developing heart conditions, you may not want to do strenuous exercises. Your choice of food, what supplements must you add, your ability to lose weight, and so much more that we're able to personalize to you by knowing what your genetic makeup is. So by understanding all of these needs, we are able to tailor-make your workout, your diets, your nutrition, your medications, your supplements, your lifestyle, even your screening plan, because no two-person screening plan are 100% identical. Precision. Traditionally, when you give chemotherapy in cancer patients, you try to destroy every single fast-growing cell. But today, we are able to target with more high precision certain cells that we want to target. So we're able to aim at those cells with with our chemotherapy and radiotherapy and just eliminate those cells. So we are able to differentiate two different groups of people. We are able to differentiate more than two different groups of people who have a certain type of disease from the mutation, and we target this specific mutations itself, and that is called precision. We aim and we destroy. There are two types of precision medicine. One is precision cure, the one above, and precision prevention. In precision prevention, which is what we advocate, is to be able to detect certain risk factors and change your lifestyle, change your screening technique. Basically, what it means is that if you have got BRCA gene, you may want to increase the frequency of your mammogram. Start mammogram earlier. Rather than 40 years old, we look at 25 years old, breast ultrasound, to know what your breast looks like, what your breast feels like, even at 16, 17 years old. So these are precision prevention. We want to develop a plan where we either stop a disease from happening, a specific disease from happening based on your genetics, or for early detection and intervention of a disease, again based on your genetics. We are also able to be more precise in our determining of antibiotics based on the DNA of your DNA, the patient's DNA, as well as the genetic makeup of certain bacteria and viruses, so that we can target them based on you and the bacteria, so that you do not develop resistance as fast as previously. So what happens is, in precision medicine, we are able to target a certain area, destroy it, or intervene and change it, modulate it, and therefore we minimize collateral damages, and we increase the effectiveness and speed of effect of medications. So precision medicine is what we call as the medicine of the future. It targets specifically the area you want to target, and not broad, and not just hit everything under the sun. Genetic testing is able to help you plan. If you have certain types of genes, it helps you make certain forms of informed decision on how you want to proceed. It helps you to decide whether earlier screening should be done, more frequent screening rather than once every 10 years. In regular people, you may want to do a scope once every 3 years if you have certain genes, KRAS genes. You may want to intervene. There's a picture on the left is me, and on the right is my girlfriend. Sorry, Angelina Jolie. So intervention. Now, intervention is a very big question. Everybody knows what Angelina Jolie did. She removed both her breasts after she had BRCA1 and 2 genes positive. But intervention and what you want to do by knowing that you have a certain gene should always be discussed with your medical professional. You may want to have customized supplements to address certain deficits that you may have, and certain times the reason that you may be having other conditions such as skin tone imbalance or hair drop, hair fall, bad breath, etc., may actually be because your body is unable to metabolize or to absorb certain nutrients, which may require you to have customized supplements and nutrition, which may not exactly be available over the counter. For example, we know that too high levels of calcium may cause stones, but in some people who have got hereditary inability to absorb calcium, you may want to have higher dose calciums, which may need to be tailor-made to you. Based on your genes, we can also tell you whether you need to change your lifestyle. More often than not, you will need to, well, generally we tell everybody to live a healthy lifestyle, but what does healthy lifestyle mean? It may differ from person to person. It may mean that you should stop caffeine. It may mean that you should stop drinking. It may mean that you should not drink so much water. In fact, so all of this may be detected and may be seen in your genetic makeup. And from that, we can also tell whether your whole family requires to be screened. Because if we know that you have hereditary diseases, more often than not, your family will require screening as well. So all of this knowledge and all of this power that's been given to you, basically what it tells you is that personalized, precise, planned, preventive healthcare. That's what we are trying to do. We are trying to, in all of my talks, I always like to end it with primary prevention, secondary and tertiary prevention. You want to stop something from happening, there's to change your lifestyle, or like Angelina Jolie, to intervene, or you want to have secondary prevention for early detection, such as increased screening frequency, increased modalities of screening, earlier screening rather than later in life, start screening earlier. Tertiary prevention, you want to have more precise treatment, precision in treatment, and to reduce your comorbidities if you have been detected to have it by a genetic test. The goal that we're trying to achieve is to improve one's lifespan, because we cannot live forever, but by detecting, we can improve the lifespan. But more importantly, it's no use to live long. You have to live quality life. So it's to improve the quality of life of individuals more than anything else. So these are the 4 P's of preventive tests of genetic testing that will matter to every one of us, which is the personalization of healthcare, of medicine, precision medicine, the ability to plan ahead, and most importantly, to plan to prevent certain disease or illness. So now I go back to my question. Doesn't this look like the doctor is trying to read somebody's palm? So let's, by looking back at my slides and a little bit of understanding, we do know that our whole body is being coded by DNAs and the gene. Everything, including the creases on our palm, our face, is being affected by the gene. And certain genes do code for multiple areas, not just your palm, your face, but also the same code can code for other parts of your body. And we also know that there may be seasonal variations. So I like to leave you with this question again. Is this ancient science, or are we talking bullshit when we talk about predicting the future? And with that, I thank you. All right, I'm open for any questions.
Yes, thank you, Dr. Alwin. If you can stop sharing your screen, we can look at everyone and see if anybody has any questions. So, ladies and gentlemen, if you have any questions on the topic that was discussed, please kindly unmute yourself, show us your face, and you may ask the questions now.
Any questions at all on gene testing?
So, Doctor, I have a question, since I think most of them are trying to still, do a couple of gene testing on themselves based on what has been discussed. Now, let's say if a person is diabetic,
Yeah.
right? Okay. So the usual norm is when someone goes to a doctor and they say that they feel lethargic, they feel tired, and all this thing, the doctor will take make a tiny prick and take a blood sample and check. Then they say, oh, your sugar level is very high, and they will say that we need to put you on the medication. Now, when they put them under medication, I have noticed that it is usually trial and error. They give them 1 dose of medication, they'll say come back in 1 week or 2 weeks, and after that they'll say if the blood sugar level is still high, they will try to change the medication, try different dosages, so on and so forth. Now, with gene testing, is it possible for us to do targeted prescription particular patient?
One of the key areas of this medicine that we talk about in gene testing is always precision medicine. Now, let's talk about, and cardiovascular is one of the key areas that precision medicine does make a difference, and that targeted therapy does make a difference. Because yes, it's true, there are certain evidence have shown that there are certain hierarchies of medication that is being used for diabetes and hypertension and so on and so forth. But let's go directly to your question on diabetes. there are two types of diabetes that we know, type 1 and type 2, insulin-dependent and non-insulin-dependent diabetes. One is because of insulin insensitivity. How do you develop insulin insensitivity? Is because one of the main reasons people develop insulin insensitivity is because of the fat genes, or so-called as your poor metabolism. Your body becomes insensitive. They do not respond to insulin. And in this condition, you respond, these are a group of people who respond very well actually to medications rather than injections. And you see these people who are, and you see them who are slightly obese, and when you do a gene test, you may actually identify a string of different genes which may point towards that direction. Secondly, you have your type 2 diabetes, and these are and certain types of patients actually, they do not produce sufficient insulin. People who do not produce sufficient insulin will have to rely on insulin injections. And when you do your genetic testings, you are able to find genes which point towards what we call as pancreatic insufficiency. The pancreas does not produce sufficient amounts of insulin. But more often than not, you get a combination of both. One comes after the other because of a negative feedback. Why negative feedback? Is if your body does not respond to insulin, your body will continue to produce more insulin until a certain point that it feeds back to your pancreas to tell you that you should stop producing. So now your pancreas stops producing insulin because your body doesn't respond to insulin. So you are looking for genes which pinpoint you to a certain direction rather than to look for a gene which codes for certain conditions. So in that sense, yes, you can actually use these genes, specific genes, to identify whether or not you will respond to certain types of medication. Hope that answers your question, Jiren.
My turn. I have a question to you, future Dr. Alwin Lam. Okay, in the sense that when we can manipulate the genes, does it mean in future we can eradicate diseases, specific diseases in certain people and all that? What do you think?
Okay, let's get this correct first. In clinical genetics, we do not manipulate genes. The ability to manipulate and change genes is still in its experimental and laboratory phases. Okay, let's get that very, 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 very clear first. We do not attempt, and neither do the drugs, modulate the genes. What we do modulate and change is the expression of these genes. What do we mean by expression of these genes? I told you why when I presented about the slides in the science part of it, I did pay a bit of emphasis in there, is because the DNA stores the information, but how the information is being translated out is in the form of amino acids and proteins. What we play about is the response of these amino acids. Either we block it, we destroy it, or we modulate it, we change it altogether. So yes, in that sense, by doing so, we can actually change the course of the disease. So for as far as clinical genetics is concerned, we detect those genetic codes in order for us to affect the protein. But yes, you are correct. In experimental genetics, laboratory genetics, there are advances on which you can remove certain genes in vitro fertilization, and they have been experimenting this on animals so that you eradicate certain components. At the meantime, the ability to eradicate diseases is very difficult because more than one gene segment codes for a disease. We can only minimize the risk, because you must also remember that gene expression, suppression, and mutation can happen because of the environment. So it's that there is so many things being involved that it's very difficult for us to say for fact that just because I change a base sequence in there or remove this certain gene segment or splice the gene, that we are able to eradicate a certain disease it's much more complicated than that, because then we must remove the external stimuli. We must also change all the sequence of codings. And sadly, if you change a certain sequence of coding, you may change the person that is being formed, because a certain code may also code for something else. For example, people have said that if you have got certain types of, if you've got certain discoloration of your ribs, certain coloration of your ribs, you are at higher risk of developing stomach cancer. So well, in that sense, face reading may actually be correct. Hope that answered your question, Chin.
Thank you very much, future Dr. Alwin Lam. Thank you.
Okay, just one more question. Now, this branch of science, this branch of prevention, healthcare. Now, how readily available is it in Malaysia or this part of the world?
Genetic testing has been around for a very, very long time. We have in fact been using it since, well, I studied it in Standard 6, and as far as time goes, it's about 20 over years. But we in Malaysia, our labs mainly do diagnostic testing. But there are many different companies and agencies around that actually do collection of samples. And because different countries and different labs have the ability to test different types of gene sequences, and so there are two things involved. Number one is your testing, number two is your interpretation of it. So for example, Japan is the world's leader in cancer diagnosis testing. So they have one of the most advanced laboratories to be able to detect, identify, and interpret cancer genes. So they're able, so based on all of these genes, they're able to tell you your risk of developing certain types of cancers by combining all of these genes together. But there are different labs that we know of as well. One of it is in Australia, which are experts in detecting certain types of chromosomal abnormalities, Cri-du-Cros syndromes and all. Sometimes it's being sent to a certain lab in Australia. But having said that, because of the advancement of communication, you can literally have the best of everything in a tube or a set of tubes, so that it can be sent to various parts of to various expert labs. So in that sense, yes, it is very widely available and is very, very easy to be done. All you need to do is spit or even take a swab. You dig your nose with a cotton bud and put it inside the medium and get it sent off, and your results will be there in about 4 to 5 months. So in Malaysia, it is widely available. Many people have done it, and in fact, we are looking at developing collaborating. The medical advisory panel is collaborating with a lab and partner to bring genetic testing to the Vaccine Plus program. So at the moment, we are looking at all our options and identifying the best packages that we can offer, and advise the Vaccine Plus team regarding the introduction of genetic testing. So it is very available, and pricing wise, it's, as far as I know, it ranges between 2,000 plus to 5,000 plus, depending on what we are testing for, how we are testing for, and the range of tests that we are doing, and the level of interpretation that comes with it. So the price varies between 2,000 to 5,000. The reason it's not cheap is because almost all of it is being sent overseas. In Malaysia, we do not have a private lab which is able to provide gene testing and interpretation of a large variety of genes. Targeted genes, yes. Targeted genes, forensic gene testing, yes, but not for gene profiling.
Thank you, Dr. Alwin. I guess Jeevan is out because his internet is pretty bad.
No problem.
Any questions? If
I may get kicked out anytime. I may get kicked out again anytime. So please take over.
all right, okay, Mr. Jeevan, that's all right. Thank you, ladies and gentlemen, for being here patiently listening to Dr. Alwin. It was like almost like a medical lecture. We all felt like for a minute that we are studying MBBS. But anyway, the best part is VaxiPlus being a network marketing company, which is completely promoting preventive healthcare, is the first time in the history of network marketing, or in Malaysia, in fact, in the world, that a group of network marketers are actually promoting preventive healthcare at the same time gene testing. And we are proud to say that VaxiPlus is part of this program to help our members get this amazing gene testing. That's a great thing, and we must thank Dr. Alwin for it to recommend this to come into the VaxiPlus program. Well, that's about it. A lot of you attendees right now this night may not know what VaxiPlus program is all about. I believe that we might have a presentation for all of you. If you are interested to find out more from the person who invited you for this presentation tonight, and we might have, or we will have a presentation for what VaxiPlus is all about. And you can also email Jeevan. He has put it in his chat room. His email address is there. I'm sure his phone numbers are there with you too. Please contact him to know more about VaxiPlus program brought to you by Magnitude Healthcare Consultancies and Rian Berhad. Dr. Alwin, is there anything you would like to add on to?
Thank you to everybody for coming, and we will hope to see you all again in 2 weeks' time. The topic of the next medical lecture will be given out in due course. So I hope to see you all again in 2 weeks' time.
Thank you, Dr. Alwin. Thank you very much. If there is no question for tonight, thank you everyone for attending, and good night.
Good night. Good night. Good night.
Thank you.